Dear ladies and gentlemen, I'm very, very happy and honored to receive the APASL Rising Star Award this year. And my name is Xiaolong from the Zhongda Hospital, Southeast University from China. And I'm very happy to deliver my award lecture titled The CHESS, means the Chinese Port Hypertension Alliance, the dedicated platform for liver health in China. I have nothing to disclosure. And in the following a couple of minutes, I would like to share the story of my academic career, also the story of chess. And currently, we have leaded the 36 multi-center trials in China, including 8 international multi-center trials, which all of these the trials focus on the port hypertension and the cirrhosis in the past 13 years. And we can always see the very excellent paper published in some high impact journals to develop some non-invasive models to simulate the HVPG or the endoscopy, some reference standard. But before we use these the models to our patients, we should usually keep in mind that the etiology of the cirrhosis in the West countries is different from most of the countries in the Asian Pacific area, and especially in China, more than 30 the percent patients with cirrhosis was caused by the HBV-related cirrhosis. So at the very first study, we developed and validated the model published by some Western group was not the just fit the HBV-related cirrhosis. Sometimes it always shows insufficient accuracy. So based on the results, the fact we develop and validate the two port pressure gradient models based on the CT angiography and the computational fluid dynamics, we call the VPPG in the gut, to firstly develop a CT-based the computational fluid dynamics, the non-invasive models. And then we try to use these models to compare with the invasive HVPG as the reference standard. This is the first study of CHESS, which we also found. The CHESS was founded in 2016, and this is our first trial of the CHESS. And in this study, we developed the two HVPG, which correlated well with the invasive HVPG. And we published this study in the radiology, and we also have obtained the several patents from China and from the United States. And the same issues, the some excellent radiologists also makes the comments to say the study was ready for primary time. And this technology was also mentioned many times and was highlighted by some review papers about the artificial intelligence. And the next study we performed in the 2017 is we use a radiomics the technique to develop and validate a model for the clinical significant port hypertension. And we published these results in eBiome medicine. And with the development of the CNN, we call the deep convolutional neural network, the technology. And we firstly use this technology for the patient with port hypertension and publish this retrospective international multi-center study in a journal of, in the clinical gastrohepatology in 2020. And last year, we used the AI technology for the non-invasive HVPG simulation. But in this study, we do the multiple classification, not only the HVP more than 10 or less than 10, we also do the three more different cutoff values like the 12, 16, and 20 to give them more information about HVPG for the clinical use. And very recently, just last month, we published a novel technology we call the vascular omics models to for the simulation of CSPH. And in this study, we based on the CT and or MRI for the 3D vascular the reconstruction, and then we developed a couple of the vascular geometry parameters, which was not routinely used in current practice, but is very helpful for that give us more information about cirrhosis or the port pressure. This is very novel technique, which we just published in radiology, and based on the previous technique, and we aim to develop a we call that intelligent detector to help the hepatologist to use this novel technique, to use this AI technology to help us make the decision for the patient with cirrhosis. So actually, this intelligent detector, which is like a post-processing workstation, to help us to provide more information. And we have summarized our previous study and collaborate with Dr. Serene and Dr. Andrews and Dr. Annalisa Zagni to publish the non-invasive approaches for the diagnosis and monitoring of portal hypertension in the Lancet Hepatology. And this work has also was cited by the ESO Clinical Practice Guidance last year and was also cited by the Lancet Commission paper last year. And very recently, the Baveno 7, which is very important consensus in the portal hypertension area, was also highlighted that the non-invasive models, not only for the HVPG simulation, but also for the endoscopy, the simulation. And the last year, we developed and validated machine learning based models for the varices screening in the chemosynthetic cirrhosis. And this is a multi-center the international study. And we screened all the clinical parameters and based on the machine learning methods. And finally, we included the platelet, liver stiffness, and total bilirubin, the three top the parameters for the predict the risk of versus bleeding. And these two parameters, liver stiffness and platelet, not only can predict high risk versus, they can also predict high risk of decompensation, and especially for the patient with liver stiffness more than 25 can predict the high risk of decompensation. So the high risk patients should be receive the following the ASBB therapy, even in the chemosynthetic stage. And lastly, in the last year, we published a novel score called the SIF score in the American Journal of Gastroenterology. And we use the four parameters, the cerebral markers, including platelets and albumin. And we use the liver stiffness and versus demonstrated by the endoscopy to construct the SIF model. And the SIF model can accurately predict the high-risk patients who had the high risk for the decompensation cirrhosis in the following follow-up years. And all of these parameters is the non-invasive for the high-risk versus. And a novel technique called a magnetically controlled capsule endoscopy can also used for the high-risk versus screening. And this the capsule endoscopy can do the direct visual of the versus and show the high diagnostic accuracy for this. I do believe the story of the chest in the area of portal hypertension is continue, and I would like to acknowledge of the members of my group and acknowledge all the chess members in China who has contributed many years for the chess study. And last but not the least, I am again am very happy and honored to receive the APASL Rising Star Award, and I do believe my team will focused and dedicated on the area of port hypertension and cirrhosis for decades. And I really hope to collaborate with the experts in the specific areas who are really focused and interested in this area. And very happy to collaborate with all of you in the near future. Thank you very much.